Introduction. Piroxicam is a non-steroidal anti-inflammatory drug, NSAID, used to relieve pain, inflammation, and stiffness associated with various musculoskeletal and joint disorders. It is a long-acting NSAID, usually taken once daily. 2. Drug class. NSAID, Piroxicam group. Non-selective COX inhibitor. 3. Mechanism of action. Piroxicam works by inhibiting cyclooxygenase enzymes, COX-1 and COX-2. This inhibition reduces the synthesis of prostaglandins, which are chemical mediators responsible for pain, inflammation, swelling, fever. As prostaglandin production decreases, pain and inflammation are relieved. 4. Pharmacological effects. Analgesic, pain-relieving. Anti-inflammatory. Antipyretic, fever-reducing. 5. Uses/indications. Piroxicam is used in the treatment of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, acute musculoskeletal pain, postoperative pain, dysmenorrhea, painful menstruation, gout, acute attacks. 6. Dosage. Adults. Usual dose, 20 mg once daily. Can be given as 10 mg twice daily if needed. Elderly. Use the lowest effective dose due to higher risk of side effects. 7. Route of administration. Oral, capsule or tablet. Intramuscular injection, in acute pain. Topical gel, local pain and inflammation. 8. Pharmacokinetics. Absorption, well absorbed orally. Half-life, long, about 45 to 50 hours. Metabolism, liver. Excretion, mainly via kidneys. Because of its long half-life, once daily dosing is sufficient. 9. Side effects. Common side effects. Gastric irritation. Nausea and vomiting. Abdominal pain. Headache. Dizziness. Serious side effects. Peptic ulcer. Gastrointestinal bleeding. Renal impairment. Increased cardiovascular risk. Skin reactions, Stevens-Johnson syndrome, rare. 10. Contraindications. Piroxicam should be avoided in patients with active peptic ulcer disease, severe heart failure, severe kidney or liver disease, history of NSAID-induced asthma, pregnancy, especially third trimester. 11. Drug interactions. Anticoagulants, bleeding risk. Corticosteroids, GI ulcer risk. Diuretics, renal function. ACE inhibitors, reduced antihypertensive effect. 12. Precautions. Take with food or milk to reduce gastric irritation. Use gastroprotective agents if long-term therapy is needed. Monitor kidney function during prolonged use. 13. Use in pregnancy and lactation. Pregnancy, contraindicated in the third trimester. Breastfeeding, use with caution.